Assalamualaikum warahmatullahi wabarakatuh semuanya. Halo, apa kabarnya nih teman-teman? Terima kasih yang sudah bergabung di acara hari ini. Perkenalkan nama saya Fauzia Fida. Insya Allah saya akan memandu acara hari ini yaitu peluncuran dari buku terbaru Mizan Publishing berjudul The Miracle of Vitamin D yang ditulis oleh Dr. Safra Zaidi MD. Apa kabar semuanya? Sudah nggak sabar pastinya ya membahas buku terbaru ini karena ternyata buku ini akan mengungkap keajaiban-keajaiban dari vitamin D yang selama ini sepertinya jarang diketahui nih oleh masyarakat. Penasaran seperti apa bukunya? Saya bacakan dulu profil singkat dari buku The Miracle of Vitamin D ini ya. Jadi vitamin D ini merupakan vitamin di antara vitamin-vitamin yang lain paling sering disalahpahami. Benarkah kebutuhan vitamin D sudah terpenuhi hanya dengan minum susu, berjemur, dan berolahraga? Nah, tahukah Anda bahwa ternyata sebagian besar masyarakat mengalami defisiensi vitamin D tanpa menyadarinya? Vitamin D ini ternyata memengaruhi nyaris semua sistem dalam tubuh, serta penting untuk pencegahan berbagai penyakit sekaligus pengobatan seperti kanker, diabetes, penyakit jantung, tekanan darah tinggi, gangguan autoimun, gagal ginjal, depresi, dan masih banyak lagi. Bahkan temuan terbaru juga membuktikan nih bahwa vitamin D ini mampu mencegah dan mengurangi risiko kematian akibat penyakit COVID-19. Nah, dalam buku ini Dr. Safra Zaidi akan menuliskan informasi yang mudah dipahami dan bisa membuka mata kita semua tentang keajaiban vitamin D. Wah, seru banget ya, terutama dengan pandemi yang terus berlangsung, tidak tahu sampai kapan ini berakhirnya, bahkan semakin melonjak. Sepertinya informasi seperti ini akan sangat bermanfaat nih ya teman-teman. Oleh karena itu, Mizaners yang penasaran seperti apa sih pembahasan vitamin D, bisa langsung memiliki bukunya, bisa langsung ke Shopee. Ada di link bit.ly/tmpd di Shopee atau juga di Tokopedia di link bit.ly/tmpd di Tokped. Ada di description box atau mungkin teman-teman bisa langsung cek ke Instagramnya Mizan Publishing atau ke websitenya mizanpublishing.com. Jangan lupa ya, The Miracle of Vitamin D, karya Dr. Safra Zaidi. Nah, hari ini tentu saja kita akan membahas buku ini nih secara mendalam langsung dengan penulisnya yaitu Dr. Zaidi. Tidak hanya dengan penulisnya, insya Allah nanti kita juga akan menghadirkan narasumber yang merupakan juga penyintas penyakit COVID-19 dan juga menulis pengantar nih dalam buku The Miracle of Vitamin D yaitu Bapak Dahlan Iskan. Nah, sebelum diskusinya dimulai, tentunya teman-teman udah nggak sabar, teman-teman juga penasaran apa aja sih keajaiban vitamin D dan benarkah bisa mengurangi risiko terpapar penyakit COVID-19. Saya akan membacakan profil moderator karena hari ini diskusinya akan dipandu oleh moderator yaitu Ibu Esti Ayu Budi Hapsari. Beliau merupakan lulusan dari English Department Universitas Negeri Yogyakarta dan sudah berpengalaman menjadi penerjemah dan editor freelance sejak 2001. Nah, di tahun 2009 beliau bergabung dengan Mizan Publishing dan saat ini menjadi editor in chief di redaksi Mizan Publishing. Assalamualaikum Ibu Esti.
Waalaikumsalam, Teh Fauzia.
Apa kabar Ibu? Sehat?
Sehat ya, kita harus selalu sehat.
Sudah berjemur Ibu hari ini?
Karena kata Dokter Safras itu berjemur itu jam 10 sampai jam 3 sore itu waktu terbaik.
Oh, seperti itu. Jadi masih ada waktu ya Bu ya ternyata ya.
Ini.
Sekarang kita diskusi dulu ya Ibu ya. Silakan Ibu langsung memulai diskusi hari ini.
Oke, terima kasih kepada Teh Fauzia. Sebelumnya saya mengucapkan selamat datang kepada Pak Dahlan Iskan yang alhamdulillah bisa bergabung. Juga welcome to Mr. Dr. Safras Zaidi MD yang bergabung juga dari California, langsung dari California. Good evening, Mr. Zaidi.
Good evening.
Dan selamat pagi juga, Bapak Dahlan
Iskan. Glad to be here.
Yeah, thank you. We are also very grateful you can join us today. So firstly, I would like to introduce you to our participants. So I will talk in Indonesia for a bit, and then before we going to begin our discussion, is that all right?
Yeah, that's all right, sure.
Oke, selamat pagi teman-teman semua yang bergabung. Pagi ini kita akan berdiskusi tentang miracle of vitamin D. keajaiban dari vitamin D yang ternyata vitamin D ini sangat banyak manfaatnya teman-teman. Dulu waktu mungkin di sekolah kita belajar bahwa vitamin D itu hanya buat tulang gitu, atau kita malah lebih familiar dengan vitamin A, vitamin C, terus kemudian malah vitamin K ataupun vitamin E, tapi ternyata vitamin D ini sangat penting ternyata bagi imunitas tubuh yang kemudian juga sangat berperan dalam pemulihan berbagai macam penyakit. Izinkan saya memperkenalkan pembicara kita hari ini adalah Dr. Safras Zaidi. Beliau adalah ahli endokrinologi yang kemudian sudah berpengalaman menangani penyakit-penyakit yang terkait dengan tiroid, diabetes, vitamin D, dan hingga manajemen stres. Beliau ini sekarang adalah Direktur Jamila Diabetes dan Endocrine Medical Center di California, USA, setelah sebelumnya menjabat sebagai asisten profesor klinis kedokteran di UCLA dan Direktur Klinik Endokrin di Olive View UCLA Medical Center. Nah, beliau ini sudah berpengalaman selama 35 tahun di 3 benua, berpengalaman di dunia medis dan sudah menulis lebih dari 10 buku kesehatan. Nah, buku beliau yang paling terbaru ini adalah The Miracle of Vitamin D, ini yang saya pegang ini, yang baru saja terbit. Ini ternyata sangat revolusioner. Jadi ini menjelaskan betapa vitamin D ini sangat penting bagi terutama di era pandemi ini bagi kita untuk tetap mempertahankan kekebalan tubuh kita terhadap berbagai penyakit termasuk juga COVID-19. Nah, setelah itu izinkan saya memperkenalkan Pak Dahlan Iskan. Beliau ini kalau kita di Indonesia mungkin sudah kenal ya, siapa yang di Indonesia nggak kenal dengan Pak Dahlan Iskan. Beliau ini dulu adalah Direktur PLN yang kemudian setelah menjadi Direktur PLN hingga dari 2009 hingga 2009, kemudian beliau menjadi Menteri BUMN dari 2009 hingga 2011, beliau menjadi Direktur PLN dari 2009 hingga 2011, kemudian menjadi Menteri BUMN pada 2011 hingga 2014, dan saat ini beliau berfokus pada platform digital media harian This Way. Dr. Zaidi, I would like to introduce you to our second panel, which is Mr. Dahlan Iskan. He was the Minister of State-Owned Enterprises in Indonesia from 2012 until 2014. And last year, he survived from COVID-19. Yeah, before that, he undergo liver transplant in China, and after that he got COVID, and he survived. So I think his story is very interesting for us to hear. And right now he's focusing on Harian This Way is a digital media platform in Indonesia. Selamat pagi Pak Dahlan Iskan. Masih di mute Bapak, mohon maaf ya.
Good morning, Mr. Zaidi. Good morning.
Good morning. Hello.
Good afternoon. Good afternoon.
Good evening di sana Bapak.
Good evening.
I am very well. I'm very well. How about yourself?
Okay, I am okay.
I'm glad that you survived this COVID. I'm very glad for you.
Thank you very much. Thank you.
You're looking good. You're looking very good.
Yeah, I got liver transplant 15 years ago, and then become CEO of the National Electricity Company, and then become minister, and now retire. And every day I'm doing sport for 1 hour, and just now finished from the sport. So thank you, Mr. Zaidi.
Yeah, we are also very grateful that Pak Dahlan can join us this morning, Pak.
Okay.
We are very interested in hearing your story in surviving COVID-19.
Yes.
Thank you.
So, Bapak mungkin Pak Dahlan Iskan nanti bisa bicara dengan bahasa Inggris, tapi saya tetap perlu atau bahasa Indonesia, mana yang lebih nyaman buat Bapak. Tapi saya nanti mungkin akan menerjemahkan juga buat teman-teman ya Bapak ya. Terus bagi teman-teman yang ingin bertanya mungkin nanti bisa lewat chat atau juga bisa lewat fitur raise hand ya. Seperti itu, jadi tidak usah ragu-ragu, bisa bahasa Indonesia, bertanya dalam bahasa Indonesia, saya akan menerjemahkan. Begitu. Without further ado, let's start our talk show today. So, Mr. Zaidi, we are very thankful for your presence today. So, I would like to ask the question. I've read the book, but so I think it's all about vitamin D. It seems that a lot of problems, diseases, stems from one problem, which is the deficiency of vitamin D. How important actually vitamin D for our body?
Okay, so vitamin D is important for the normal functioning of every cell in our body. That's how important it is. So every cell in our body has a receptor for vitamin D, or in other words, vitamin D affects the function of every cell in our body.
So it's not only for the bones, right? When I was in school, yeah, our teacher always said that.
That's old thinking. Yeah, that's very old thinking. Like 50 years ago, we used to think like that. Yes, it is important for the health of the bones. It's very important for the health of the immune system. If you are low in vitamin D, your immune system doesn't work right. It's also important for the health of, as I said, every system in the body. So people who are low in vitamin D, they are at high risk of having all kind of infections, including COVID-19. They are also at high risk of having diabetes, high blood pressure, heart attack, stroke, osteoporosis, muscle aches and pains, depression, autism, also autoimmune disorders.
So the next question, Mr. Zaidi, Dr. Zaidi, is that the reasons for you to write The Miracle of Vitamin D? So what is the reasons that you write these books?
Okay, so about 20 years ago, I started this research looking at vitamin D level in every patient in my practice. And I found that more than 90% of people living here in sunny California were low in vitamin D. So I started giving them vitamin D supplement. And what I noticed that there was improvement, a significant improvement in their blood sugar. People who were diabetics, they were able to control their blood sugar better. And they were not having muscle aches and pains. And people who had osteoporosis, their bone started to get stronger. And most of the people in my practice did not need any heart problem. They did not need, bypass surgery or stent placement in the coronary arteries. And so people were just doing so well. And I saw a big difference when I started giving this vitamin D. So then I'm like, okay, I need to take this message across to a wider population. And that's when I decided to write the book so people can benefit from it. One more thing.
Yes.
My patients always told me that ever since they started taking vitamin D, they rarely get any flu. So, and myself, I don't get flu. And I take vitamin D.
So, Dr. Zaidi, how do we get vitamin D? Is it only from supplement, or we can get from the sunshine, or maybe other protein or other kind of foods?
Okay, I'm glad you asked that. So, the main natural source of vitamin D is sun. And you can't get it enough from food. Food is not a good source. So sun is a very good source, but the problem is lifestyle. So in order to get enough vitamin D from sun, you have to be outdoors without any clothes on 4 to 6 hours every day. Only then you can get enough vitamin D from sun.
4 to 6 hours every day. We need to be outdoors.
4 to 6 hours every day. I started checking this vitamin D level in all of my patients, and everyone was low in vitamin D. Although they were going outdoors half an hour every day, and they were even taking regular multivitamin, which has 600 IU of vitamin D, and they were all still very low in vitamin D. There was only one patient whose vitamin D level was very good. So I asked her, what does she do? She was a lifeguard at the beach. So she was out in the sun for about 6 hours every day. And so besides that, I have never seen anybody who is not taking supplement to have a good level of vitamin D.
Especially for us who work in an office building, right?
Yeah, what happened that most of us, we live indoors. I mean, we work in the offices. And even when we go out over the weekends, we cover ourselves with clothes. So when you have clothing on, then your vitamin D synthesis is cut down by 50%. In the same way, when you are in the shade inside the house, your vitamin D synthesis is very low. Also, when you go out, the only little area that we have exposed is our face, right? Well, what do we do on our face? We apply some sunscreen, right? So any sunscreen that is SPF 8 or above will block your vitamin D synthesis. So for all these reasons, you may be living in a sunny place like California or Saudi Arabia or Pakistan or Indonesia, but your vitamin D level will be very low because of all these factors. It's our lifestyle that is making vitamin D deficiency. Yeah, sun is there, but we don't get enough vitamin D from it because of our lifestyle.
Nah, Dr. Zaidi, there is a question from Mr. Basrah. He asked, what about the potential cancer, skin cancer risk?
Yes, if you
under the sun,
yeah, it varies from person to person. So if you have fair skin and if you are outdoor for 6 hours, yeah, there is a high risk of having skin cancer. So yes, and for that reason, the real practical way of getting enough vitamin D really is through vitamin D supplement. But it should be the right dose, and we'll come to that, I think, later. Most multivitamins just have 600 IU, and that's not enough.
So we're going to talk about vitamin D and COVID right now. So because in Indonesia, right now, the situation of COVID is rising steeply. So some of the cities and provinces are already taking steps to limit the movements of the people. So you also in this book talk about dedicate one chapter on vitamin D and COVID. Could you tell us what is the correlation between vitamin D level in our body with the COVID-19 risk?
Okay, so vitamin D is extremely important for the normal function of our immune system. So when you are low in vitamin D, you are at high risk of having COVID. And there are a lot of studies from all around the world, like from US, from UK, from Iran, from Australia, from all over the world that have shown that if you are low in vitamin D, you have high risk of getting COVID-19, and you are also at high risk of dying from it. I have mentioned those studies in my book. And if you want, I can go in some detail about those studies, but I'm just telling you the net result, that there are a lot of studies, lots and lots of studies that clearly show that your risk of getting COVID-19 is cut down by 50% if your vitamin D level is more than 50. Okay. So just remember this number 50. So if your vitamin D level is more than 50, your risk of getting COVID-19 is cut down by 50%. In the same way, when your vitamin D level is less than 30, then your risk of dying from COVID-19 double.
Nah, itu semuanya ada dibahas oleh beliau di buku ini. Nah, untuk detailnya mungkin kita tidak bisa membahasnya di sini. Ini semuanya ada bisa dibahas di sini, dibaca. Ada satu bab khusus tentang vitamin D dan COVID. Excuse me, Dr. Zaidi, I would like to ask Mr. Dahlan Iskan right now. Pak Dahlan, apakah ada?
Yes.
Ya, yes. Pak Dahlan. Pak Dahlan, since you had COVID, you talk about your level of vitamin D in your body and also in your family. And and you write it in an article, and that article we are using that article as the introduction for this book. So could you tell us what kind of symptoms when you feel when you got COVID, and how can you reach the conclusion that one of the factor is because your low level of vitamin D?
Yes, of course. That time I have no symptom, also very, very light. But because my friend got COVID, and then I checked in the lab, and then positive, but almost no symptom. But because I already 70 years old, so my son and my daughter asked me to go to hospital by force, because actually I don't want to go to the hospital. And then in the hospital, they checked my vitamin D level, and only 21, I think. I was only 21. And
very low.
Yeah, very low. And then doctor give me vitamin D. But my son lower than me, my daughter lower than me, even though my daughter cycling every day, cycling 100 kilometers a day, 150 kilometers a day, almost no holiday for them, for my son and my daughter, for cycling. Every day they're cycling. But how can the level of the vitamin D so low? Then a doctor gave me a vitamin D supplement, and then now I have 56 level. My level is 56. But I have a question, Dr. Zaidi. Doctor said that even though we are under the sun, if we do not consume milk or yogurt, and then it is it is useless. It's right that there is some combination between sun and yogurt or milk.
Well, the amount of vitamin D in milk is very, very small, and so drinking a cup of milk is not gonna do it. Same way, as I said, when we go outdoor, and you mentioned that your son and your daughter, they are cycling every day. And so are my patients here. And I check their vitamin D, and always low. So really the only best way to get vitamin D is taking a high dose of vitamin D supplement every day. That is the only way you're going to get a good level of vitamin D.
Okay, thank you.
Okay, Dr. Zaidi. So we came to the question about the dose. So many of us, there are questions from Ms. Sari. Many of us consume vitamin D without checking the level of our vitamin D in our body first. So is it necessary to check first with the doctor and before we consume the vitamin D, and what is the best dose for the average people?
You asked two questions. So one is,
Yes.
do we need to check a blood level, test for the blood for vitamin D
Do we need,
before we start taking vitamin D? It's not necessary, because unless you are on the beach in your shorts 5 to 6 hours every day, then you don't need to take vitamin D supplement. But for everyone else who are living just the usual life, you are gonna be low in vitamin D. If you want, you can have it checked. But based on my testing, I mean, I tested thousands of people with this. Then I stopped testing after a while. It's like everyone is low in vitamin D, so what's the point? So you don't have to have, it's not necessary to have your blood test. But if you are curious, if you want to know, you can have it done. And so based on treating thousands of my patients, I came up with a formula for vitamin D dose. Now, vitamin D is fat soluble. Because people who are have a lot of fat, who are obese, vitamin D gets into their fat and it gets trapped there. So it's not available for the rest of the body. So that's why the dose of vitamin D is not the same for everyone. It depends on your weight. And the formula that I came up with many years back is 5,000 IU, international units,
yes,
for every 100 kg, sorry, 100 pounds.
So
of
that's
your weight.
around 55 kilograms
That will be something like that. Yes, yes.
every day.
So every day, yes. And so for an average person, like 70 kilogram, the dose will be about 7 to 10,000 IU per day. So you can easily take 10,000 IU per day without any risk. So a lot of people who have not treated high doses of vitamin D, they always write that, oh, vitamin D toxicity, and they, so let me tell you that in treating really thousands of patients with these doses, the usual dose in my practice is 10,000 IU per day
10,000.
for my patients.
Okay.
10,000 IU per day. So for an average person, 70 to 80 kg, the dose is 10,000 IU. If you are about 50 kg, then the dose is about 5,000 IU. And if you are 100 kg or above, then the dose is 15,000 IU per day. So I've been using these doses in my patients, and I've never seen any case of vitamin D toxicity. Okay, that's my almost 20 years of experience using these doses in of patients, and not a single case of vitamin D toxicity. So then I've done some looked in literature about cases of vitamin D toxicity. And there are just very few cases of vitamin D toxicity which have been described. And in every one of those cases, those people were taking more than 80,000 IU per day for several months. Okay, so
that's
when you take
the overdoses.
That's where toxicity can develop if you take more than 80,000 international units per day for several months.
Oh, yes.
Okay, so these are the scientific facts. So vitamin D is extremely safe in the doses of 5,000, 10,000, 20,000, 30,000 IU per day. It's extremely safe.
Dr. Zaidi, so in your books, you talk about several kinds of vitamin D. There are vitamin D3, vitamin D2. So could you tell us about the kinds of vitamin D and what is the best kind of vitamin D for us to avoid the risk of getting COVID-19?
Okay. So there is vitamin D2 and vitamin D3. So vitamin D2 is for the plants. Plants manufacture vitamin D2. Whereas animals, including humans, we produce vitamin D3.
D3.
D3. So for humans, for us, we should take vitamin D3. Okay. And the dose should be, as I mentioned, 5,000 IU if you are about 50 kg, 7,000 IU to 10,000 IU if you are about 70 kg, and 15,000 IU if you are 100 kg or above. And with these doses, you're gonna get good level of vitamin D and no vitamin D toxicity. So this will help you to lower your risk of even getting COVID. As I said, with these doses, you can get your vitamin D above 50, and your chances of getting COVID is cut down by 50%. And even if you get COVID, your chances of surviving COVID increases dramatically. So just taking a good dose of vitamin D every day, you can lower your risk of getting COVID, and you are increasing your survival from COVID.
Okay, selamat pagi Pak Dahlan.
Pagi.
After you got COVID-19, so do you take a vitamin D supplement every day, and do you what kind of lifestyle changes that you do after you got infected from COVID?
I take vitamin D3, 10,000 IU every day, and I have to buy from abroad because in Indonesia, Dr. Zaidi, there is no 10,000 vitamin D3 in shops, so we have to. And luckily, my son just came from US, cycling in US, and then I asked him to buy a lot of vitamin D, 10,000, because maximum in Indonesia, maximum they sell only 5,000, right, Mbak? Yeah, we cannot get 10,000 in Indonesia.
Maximum is only 5,000, Pak Dahlan.
Yeah, so far I know, but maximum we can buy only 5,000. So I take 10,000 every day, and my lifestyle almost no changing because from a long time ago I do sport in the morning from 6 o'clock until 7:30, and outdoor it is dancing, something like
dancing.
Dancing, and then I also I change my house to renovate outdoor space, so
to get more
I
fun.
do a lot. Yeah.
So Dr. Zaidi, do you have any suggestion or comment for Pak Dahlan Iskan to help him maintain his health?
Yes, so it's for everyone. So after doing about 40 years of medicine, I have come up with a strategy to how to stay healthy. So the acronym for that is SNEVM, SNEVM. SNEVM. So S is for stress management. That's number one. If you don't do stress management, then you are at very high risk of having poor health. That's
so stress is the most important. Stress
management is number one, the most important thing. And number two, N is for nutrition.
Nutrition.
Good nutrition every day. Number three, E is for exercise. And rest. Too much exercise is not good. Too much rest is not good. And always get at least about 8 hours of sleep at night. Good sleep at night, at least 8 hours. In the morning, you get up and you are really fresh and you have a lot of energy. Then you got good night's sleep. Then the next is V, which is for vitamins. And herbs and other supplements.
Okay.
And last is M, which is for medication as the last resort. So I will repeat SNEVM. S for stress management, N for nutrition, E for exercise, rest, sleep, V for vitamins, M for medications, if and when necessary.
Okay, okay, thank you very much. Dr. Safras, Mr. Handian said that stress management, nutrition, exercise and rest, vitamin and medication really spoke to me. Thank you, he said. So I think one of the problem of modern people, right, Dr. Safras? So usually we can balance all of them. So our stress managing is not very good, and then we lack exercise. We sit almost like 8 hours every day in our desk.
And we don't sleep enough. We just get 6-7 hours sleep, and we don't rest enough. And as you said, I think stress management is the most important thing. Stress is a major reason actually why people are getting sick so much.
So, especially in this pandemic era, so we tend to get panic easier. This happens to me in the earlier stage of pandemic. Whenever I hear someone that I know got COVID, then I panicked. So do you have any suggestion on how we because the pandemic will not end soon, I think.
Yes, absolutely. Stress management has become my passion actually, and I've written a book on it. Here it is. Here is my insight into stress management. It's actually very simple. Stress comes from excessive thinking. When we think too much, we are thinking, what will happen? What will I do? What if, right? Yes. So that's when all the worrying starts. So it's excessive thinking that causes worrying, that causes anxiety, that causes the lack of sleep.
In Indonesian, young people call it overthinking.
Okay, busy mind. Excessive thinking, busy mind going round and round. Yes. So, so the next question is how you can be free of that busy mind, that excessive thinking, busy mind, how you can be free of it, right? When you are free of it, then you have no stress. And here is my quote that you can write down. And the quote is, keep your mind where your body is. Just keep your mind where your body is. Be aware of your surroundings. Use your 5 senses. What you see, what you hear, what you smell, what you taste, what you touch. So we have these 5 senses, use them and keep your mind where your body is.
Okay.
So if you're sitting in your backyard, stay there. Don't think about anything else. Stay in the now by using your 5 senses.
Maybe
When you are in the kitchen cooking, keep your mind there, 100%. When you're driving on the road, keep your mind on the road. Don't think of anything else. Just enjoy the trees, the clouds. Enjoy what is happening with your 5 senses. So when you put your 5 senses to work, you keep your mind where your body is, then there is no excessive thinking.
I see.
And no excessive thinking means no stress, no worrying, no problem.
Maybe to enjoy the now when we are in the backyard, turn off the phone. Don't check your WhatsApp.
Everywhere
don't check
actually.
your messages.
Even when you are inside, as I said, when you are doing dishes and you are cooking, when you are sitting and doing nothing, always have some time where you do nothing. Just sit down for 10-15 minutes and say, I'm not going to do anything for 10-15 minutes. And use your 5 senses, and that will bring you peace. We always have peace here. We are not aware of it. So pay attention to peace here. But unfortunately, our attention stays here in the head.
Yes.
So take attention away from the head, put it here in your chest.
Yeah.
And right away you will feel peace.
Okay, Dr. Zaidi, this is the last question because the time is almost running out. So your book is already published. Hopefully this will be available in stores, offline and online soon. Do you have, what are your hopes for your Indonesian readers who read The Miracle of Vitamin D?
Well, my biggest hope is that they get good knowledge from it and then they put it into practice. So knowledge is of no use if you don't put it into practice.
Yes, right. Correct.
So let's hope that readers will be able to put it into practice. And that's when it counts.
Okay. So, and what's most important is right now we have to go to the pharmacies and get our own vitamin D supplements.
Yes, so exactly. So after you read the book, you will really understand the importance of vitamin D. We have truly just scratched the surface here. And after you read the book, you'll understand how important vitamin D is for our health.
Yes.
And then the next step is start taking vitamin D supplements.
Thank you very much for your time, Dr. Zaidi. Hopefully we can meet again sometimes, or maybe you will have time to visit us when the pandemic is over. So good night. Thank you for your time. I will give the time back to Fauzia as the Master of Ceremony. Silahkan Fauzia. Terima kasih.
Okay. You are welcome. You are welcome.
Good night,
Thank you
Mr.
so much,
Have a good rest.
Terima kasih sekali Bu Esti sudah memandu acara diskusi tadi, sangat bermanfaat sekali ya, ternyata banyak sekali informasi yang sebelumnya ini ya seperti Bu Esti bilang ya, di sekolah kita diajarkannya kalau vitamin D itu misalnya minum susu gitu ya, atau berjemur, ternyata itu tidak cukup. Dan ternyata vitamin D ini juga sangat vital untuk kesehatan tubuh kita, tidak hanya untuk pertumbuhan tulang, tapi banyak sekali manfaat lainnya. Dan teman-teman bisa banget nih mencari informasi seperti yang tadi Bu Esti bilang, diskusi hari ini hanya permukaan saja, tapi informasi tentang keajaiban vitamin D ini bisa langsung didapatkan pada buku The Miracle of Vitamin D karya Dr. Safra Zaidi. Bisa langsung didapatkan di Shopee atau Tokopedia. Linknya kalau di Shopee di bit.ly/tmvdd di Shopee, dan kalau di Tokped ada di bit.ly/tmpd di Tokped. Jadi jangan lupa ya teman-teman, bisa langsung klik linknya, ada description box, atau bisa cek juga infonya di Instagram Mizan Publishing atau di website mizanpublishing.com. Terima kasih banyak semuanya sudah bergabung. Terima kasih Dr. Zaidi dan Pak Dahlan Iskan. Terima kasih Bu Esti. Mudah-mudahan acara hari ini bermanfaat dan bisa ada yang kita aplikasikan ya, tentunya setelah membaca buku The Miracle of Writing. Saya Fauzia Hafida. Terima kasih banyak. Mohon maaf apabila ada kesalahan. Sampai ketemu di acara Mizan Publishing lainnya. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you very much.
Thank you.